Thank you once again. So nice to be back on your channel. And we are continuing with our series of discussion on constipation. And this is our third video on this topic. And again, I'm going to be touching on a topic of constipation or not passing stool or not passing meconium in a newborn child. Now, these are the children which should be investigated, as I said, that they can have a serious underlying problem. And if it is a proven Hirschsprung disease, they need certain management. They should be admitted in the neonatal intensive care unit. And we run a series of tests, which we call the contrast study, where a certain radio-opaque dye is inserted through the rectum and certain x-rays are taken, which help us in making a diagnosis. And once the diagnosis is made, there are two ways. Either we do a rectal washout, so as to enable the child to pass some gases and some stool and deflate the whole abdomen in a way that the child can take feed if appropriate, or we go on to do a rectal biopsy. We have the facilities of doing a newborn rectal biopsy, and we do a suction rectal biopsy these days, and with a frozen section histopathology, we get a diagnosis as a spot diagnosis, I would say, and this helps in our counseling to the parents and their understanding of the disease. Remember that the overall incidence of Hirschsprung disease is about 1 in 5,000, and in some studies it is up to 4,000, that every child after 4,000 or 5,000 live births can have a Hirschsprung disease. And its incidence is more common and more prevalent in certain geographical parts of the world, like for instance in Oriental population it is more common as compared to the Occidental population. It's more common in Japan. So there are certain screening tests also which are done, and one of the screening tests which is done is called the manometry, where the pressure studies are done, and these are also available these days. But as I said, that these are screening tests and they may not be highly reliable unless we have the appropriate instruments to see the pressure effects on the large intestine.